Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The Bass method of toothbrushing, correctly employed, removes dental and intraclavicular plaque. This method includes both the use of the toothbrush and dental floss. But this film will demonstrate only the toothbrushing part of the Bass technique. A multi-tufted brush, such as Right Kind or similar type, is used. The tufts of the bristle should end in a slightly rounded tip, and the end of each bristle should be blunt. Note the separation between the bundles of bristles to facilitate cleaning the toothbrush. The bristles are resilient, and each bristle is about 7/1,000th of an inch in diameter. The blunt end of the bristles is a safeguard against injury. The toothbrush should be held in a firm grip with all the fingers. The brush can be rotated in the hand to provide access to various areas of the mouth. Proper placement and action of the brush will now be demonstrated on the typodont. The brush is placed at approximately a 45-degree angle to the teeth, with the bristles pointing apically. Part of the brush covers the buccal surfaces of the teeth, while other bristles extend over the occlusal surfaces. The bristles penetrate into the gingival crevice, while the brush handle is being moved in small rotary or vibratory movements, without actually changing positions of the tips of the individual bristles. Several teeth may be covered simultaneously by the brush, while it is gradually moved from one area of the dentition to another. Proper brush position and bristle action is illustrated in this close-up of the distal buccal aspect of the last maxillary molar. The correct position and action for cleaning the palatal surfaces of the maxillary molars and bicuspids is demonstrated. The position and action of the brush must be changed for the palatal side of the maxillary anterior teeth. The occlusal surfaces are partially cleaned, while the buccal and lingual surfaces are brushed. But it is advisable to finish the brushing by directing the bristles into the occlusal surfaces with small vibratory movements. The following sequence is recommended for brushing the maxillary teeth. Start with the buccal surfaces of the maxillary right molars, moving up to the bicuspids, and then to the labial surfaces of the front teeth. Continue with the left front teeth and move to the buccal surfaces of the left maxillary bicuspids and molars. Change over to the palatal surface of the left maxillary molars, bicuspids, and palatal surfaces of the anterior teeth. Then move to the palatal surfaces of the right bicuspids and molars. Brushing the occlusal surfaces of the molars and bicuspids completes the cleaning of the maxillary teeth. The brush position for the buccal aspect of the mandibular posterior teeth is now demonstrated. Again, note how the bristles are placed into the gingival crevice. The brush is gradually moved forward, one tooth at a time. The position of the brush for cleaning the lingual aspects of the mandibular posterior teeth is shown. Again, note the vibratory movements that are used. In order to reach the lingual aspect of the mandibular anterior teeth, the brush must be placed in an anterior-posterior position with the bristles pointing into the gingival crevice. The brush should not be pulled forward as shown here, since this will prevent the bristles from entering the gingival crevice. When the brush is placed in the proper position, the bristles will enter the gingival crevices and at the same time clean the teeth. The sequence of brushing the mandibular teeth is as follows. Start with the buccal aspect of the mandibular molars and bicuspids on the right side. Move forward to the anterior teeth. Then shift to the left anterior teeth, bicuspids and molars. Switch over to the lingual aspect of the left molars, bicuspids, and the lingual aspect of the anterior teeth. Finish with the lingual aspect of the lower right bicuspids and molars. Then brush the occlusal surfaces of the mandibular posterior teeth. The Bass method of toothbrushing will now be demonstrated on a patient. Brushing is started at the buccal aspect of the right maxillary molars. The brush is first placed on the teeth and the bristles allowed to slide into the gingival crevice. Small vibratory movements are made. Note the blanching of the gingival tissues in response to the pressure of the ends of the bristles. In order to clean an area of gingival recession, it may be necessary to change the position of the brush so the bristles can be worked into the gingival crevice and clean the entire exposed tooth surface. As a result of previous faulty toothbrushing, this patient has experienced some gingival recession. In spite of the rigorous but faulty toothbrushing, she has not been able to keep her teeth free of plaque. Areas of gingival recession and irregularities of gingival contour may require special modifications of toothbrushing in order to accomplish complete plaque removal. Brushing of maxillary molars and bicuspids on the palatal side will now be demonstrated. Note how the bristles are placed into the gingival crevice with the resultant blanching of the gingival tissues. This is the proper brush position for cleaning the palatal aspect of the maxillary anterior teeth. If an anterior pull is made on the brush, the teeth and the gingival crevice will not be adequately cleaned. Observe the different action of the bristles when the brush is used correctly without pulling the handle forward. Finally, the occlusal surfaces of the maxillary posterior teeth are brushed. As previously demonstrated on the model, the bristles are directed into the occlusal surfaces with small vibratory movements. brush position and action for cleaning the buccal aspects of the mandibular molars and bicuspids will now be demonstrated. Note how the bristles enter into the gingival crevice and remove the plaque at the cervical areas of the teeth. Brushing is extended to the anterior teeth using vibratory movements. It is important that the brush is placed in the correct position to reach into the gingival crevice on the lingual aspect of the posterior mandibular teeth without interference from the tongue. The bristle should also be directed into the gingival crevice on the lingual aspect of the mandibular anterior teeth. The brush should not be pulled forward because the bristles will bend and cannot enter the gingival crevice. Proper action of the brush may also be achieved with the lower incisor teeth separating the bristles, as long as the bristles are allowed to enter into the gingival crevice. Brushing the occlusal surfaces of the lower posterior teeth is now demonstrated. This patient has not maintained oral hygiene for 4 days in order to demonstrate patterns of plaque formation and plaque removal. Disclosing solution has been applied to the teeth. Note the heavy plaque formation on all teeth at the gingival margin. The plaque adheres tenaciously to the surfaces of the teeth, and considerable effort is required to remove it. The brush position and action for cleaning the maxillary posterior teeth are demonstrated. Also note the brush action on the left cuspid and bicuspid. In order to remove the plaque in the area of gingival recession over the cuspid and first bicuspid, the toothbrush is placed in a modified position, allowing the bristles to work on the tooth surface and to enter the crevicular areas corresponding to the recession. The action of the toothbrush upon the plaque is seen on the buccal aspect of the posterior mandibular teeth on the right side. Note that in spite of considerable effort, there is still some residual plaque, indicating the need for further brushing. The Bass method of toothbrushing is one of several acceptable methods for maintaining clean teeth and good oral hygiene.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.